Beta-adrenergic agonists, also called beta blockers. The color here is yellow because the 0.5% of timolol in most of these medicines is yellow in the cap color. Some are blue if they're a lower concentration. Also known as beta blockers, they were really the mainstay of glaucoma management for many, many years until they were displaced by latanoprost and other prostaglandin analogs. Their mechanism of action is that they decrease aqueous production. They don't lower pressure during sleep, which is important to recognize. So both the alpha agonists and the beta blockers don't really work very well when you're sleeping. This class of medicine can demonstrate tachyphylaxis, meaning that over time the medicine becomes less effective. And most beta blockers are non-selective with both beta-1 and beta-2 activity. Betaxolol is a selective beta-1 blocker and has less pulmonary activity, so less likely to cause bronchospasm and things like that. So just our little diagram of the anterior segment of the eye, the red arrow pointing to the ciliary body. So this is an aqueous suppressant. Aqueous suppressants really are useful for all forms of glaucoma. Perhaps the exception would be normal tension glaucoma, particularly in patients who have systemic hypotension, and certainly using it in the evening in someone who has hypotension is probably not a great idea because the blood pressure goes down when you're asleep, and if you make it go down further with the beta blocker, and as we said, it doesn't do much to aqueous production during the sleeping hours, it's really not a very helpful therapy. Under the normal tension glaucoma talk, we will deal with the Logit study, which basically shows that these are less effective than alpha adrenergic agonists for people who have normal tension glaucoma. Absolutely contraindicated in people who have asthma, and I'm afraid to use it in anyone with significant pulmonary disease or people who are bradycardic. It has very few, as a class, very few ocular side effects. Like any medicine, people can become allergic to it, but often that's a benzalkonium chloride allergy. But there are lots of systemic side effects. And the beta blockers topically get into the bloodstream well and can exert effects throughout the body. The way that I explain this to the patient is that if I give a drop in the right eye, there'll be enough systemic load that it will lower the pressure in the left eye. The systemic side effects include bronchospasm, bradycardia. In someone who's diabetic, it can mask the hypoglycemic symptoms that would indicate that their insulin balance is off. It can cause fatigue or sexual dysfunction. In the U.S., it's supplied as timolol, which was the first medication in both 1/4 and 0.5%, and then other very similar medications. I would point out betaxolol, which is the one that is cardioselective and in theory safer for people who have pulmonary disease, but I would not encourage you to use it in people with pulmonary disease. Cartiolol is supposed to have less effect on serum lipids. It's also available in combination medicine with dorzolamide and also with brimonidine. The thing that I've seen with combination medicines is that people forget what's in them. And so where they would maybe never think to put an asthmatic patient on timolol, they might forget that there's timolol in Combigan or Cosopt and give that to somebody with lung disease. This is either given in the morning or twice a day. We're kind of drifting more and more to just giving it once a day in the morning. So the key points are that this class of medication inhibits aqueous production. It is fraught with multiple systemic side effects, although most people who are on beta blockers do fine. And beware in patients who have pulmonary disease. So often this is the second category of drugs that we would go to after prostaglandin analog. Perhaps have somebody on a prostaglandin analog in the evening and a beta blocker in the morning. And that's actually pretty good additivity and a pretty good regimen, easy on the patient in terms of their schedule.